Did you know that around 1 in every 3 adults may have fatty liver? What's even more surprising is that many people don't even know they have it. That's because fatty liver is often called a silent disease. In the beginning, your body may not give any of the warning signs. No pain, no discomfort, no major symptoms. But inside your body, fat keeps collecting in the liver little by little. And if this continues for years, it can damage the liver and lead to serious health problems. That's why understanding fatty liver early is so important. So, let's first understand what exactly is fatty liver. Before we talk about fatty liver, let's understand what the liver actually does. Think of your liver as your body's main processing center. Everything you eat or drink passes through the liver. Liver removes harmful substances from your blood and also helps digest food. Liver stores energy for later use and also helps control your blood sugar levels and cholesterol levels. In short, your liver works all day long, every day to keep your body healthy. Now imagine this hardworking organ slowly filling up with fat. A small amount of fat inside the liver is completely normal. But when too much fat starts collecting inside the liver cells, it is called fatty liver disease. At first, this extra fat may not cause any problems, but if it keeps increasing, the liver finds it harder to perform its normal functions. Over time, this can damage the liver. There are two main types of fatty liver. The first is alcoholic fatty liver disease. As the name suggests, this happens because of excessive alcohol consumption. The second is non-alcoholic fatty liver disease, also called as NAFLD. This happens in people who drink very little or no alcohol at all. Instead, it is usually linked to obesity, diabetes, high cholesterol, unhealthy eating habits, and lack of physical activity. Today, this is the most common type of fatty liver seen across the world. Now comes the most important question. How does fat actually collect inside the liver? Let's understand this step by step. Every time we eat, our body gets energy from the food. The liver helps process the energy. Some fat is used immediately, some is sent to different parts of the body, and only a very small amount is stored in the liver. As long as the balance is maintained, everything works normally. The problem starts when we regularly eat more calories than our body actually needs. This could be because of sugary drinks, junk foods, deep fried foods, high processed snacks, or simply eating too much and moving too little. Slowly, the body starts storing the extra energy as fat. At the same time, many people develop something called insulin resistance. Now, don't worry about the name. It simply means the body cells stop responding properly towards insulin. Because of this, more fat is released into the bloodstream. This extra fat reaches the liver. Now, the liver has a problem. It is receiving more fat than it can use or remove. So, where does all this extra fat go? It starts getting stored inside the liver cells. Day after day, month after month, more fat keeps collecting. In the beginning, the liver still manages to work normally. But after some time, these fat-filled liver cells become unhealthy. The body reacts by causing inflammation. If this inflammation continues for years, healthy liver tissues slowly changes into scar tissues. This condition is called fibrosis. If the damage continues, fibrosis can progress into cirrhosis, where large part of the liver becomes permanently scarred. And in severe cases, cirrhosis can eventually lead to liver failure or even increase the risk of liver cancer. The most scary part is, during most of this process, you may not feel anything at all. Now that you know how fatty liver develops, the next question is, how do you know if you already have it? In part 2, we'll reveal the symptoms, the medical tests you should know about, and the most effective ways to reverse fatty liver. I'll see you there.